Hello everyone and welcome back. In today's class, we're going to be talking about the spermatic cord. And please, if you are yet to subscribe to this channel, please do so. So let's move. Now, the spermatic cord is a suspensory bundle of structures passing between the deep inguinal ring and the testis. Let's use this diagram to explain that. Say that spermatic cord is a suspensory bundle of structures passing between the deep inguinal ring here and the testis. The extents, just like we just said, is from the deep inguinal ring to the scrotum. And having said that, let's talk about the labels of this diagram. We have the external spermatic fascia, the cremasteric muscle and fascia. We have the internal spermatic fascia. This is deep inguinal ring, marking the beginning of the spermatic cord, and here is the testis. So having said that, let's move straight to the formation of the spermatic cord. Now, the spermatic cord is formed during the descent of the testis. That's the formation of the spermatic cord. It is formed during the descent of the testis. So let's go to the coverings. The spermatic cord has three coverings. Number one is the external spermatic fascia. Number two is the cremasteric fascia plus muscle. Number three is the internal spermatic fascia. I'll be using this diagram to explain that. Now, this first layer is the external spermatic fascia, and it is formed from the external oblique muscle, because this whole covering, they are from the abdominal wall layers. So the first one, the external spermatic fascia, is from the external oblique. The second one is the cremasteric muscle and fascia. This is from the internal oblique muscle, while the third one is the internal spermatic fascia, is from the transversalis fascia. So once again, that's three coverings. The first one is the external spermatic fascia from the external oblique aponeurosis. The second one is the cremasteric muscle and fascia from the internal oblique. Then the third one is the internal spermatic fascia from the transversalis fascia. So let's go to the contents of the spermatic cord. Now, this can be treated under four major subheadings. We have ducts, we have arteries, we have veins, and we have nerves. Ducts, arteries, veins, and nerve. So the ducts is the ductus deferens. The duct is ductus deferens. The arteries, part of the contents, is the testicular artery, the cremasteric artery, the artery to vas deferens. Then for the vein, we have the pampiniform plexus, which is for its exchange. And for the nerve, we have the genital branch of the genitofemoral nerve. And also have the testicular plexus. Once again, we have ducts, we have arteries, veins, nerve, ductus deferens, testicular artery, cremasteric artery, artery to vas deferens, pampiniform plexus for its exchange. Then we have genital branch of the genitofemoral nerve and testicular plexus. So let's go to the lymphatics. The lymphatics is from the testis to the para-aortic lymph node. From testis to the para-aortic lymph node. So let's go to clinical correlation. The clinical correlation of the spermatic cord. We're talking about two of them. The first one is called the varicocele. The varicocele is a medical condition where there is a dilation of the pampiniform plexus. And the second one is the testicular torsion. And in testicular torsion, there is twisting of the spermatic cord. So I believe that with this, you understand the anatomy of the spermatic cord. Please, if you have any questions, don't forget to drop them in the comment section. Thank you so much.